Alright, so I'm going to bring in Dr. Goldman in just a moment.
Okay.
We're going to do a full facial evaluation, and to do that we use a very special camera. It's called a can-filled VISIA, and I'm going to be taking some photos of your face, and then Dr. Goldman will put these up on the TV screen here,
Okay.
and we'll talk them through with you, okay?
Okay. Hi.
I'm Dr. Goldman.
I'm
So what can I do for you today?
So I came in just to get an overall skin check, and then I've had this dry patch on my face, I don't know what side on this one, for like 2 months, and I have no idea where it came from. I haven't ever really had like bad acne, so I don't know what it is. It's really bugging me.
So how do you wash your face?
So I literally just take a bar of soap in the morning. It's normally just the Dove Sensitive, and then wash my face with just a bar of soap, and then at night I use Neutrogena.
And do you use your hands to wash?
I do use my hands.
And do you put any moisturizers or any other things
Yeah.
on your face?
Yes, I use a moisturizer twice a day in the morning and at night.
And do you recall the name of the moisturizer?
It's Neutrogena.
Okay.
Yeah.
Do you know what kind of Neutrogena moisturizer?
It's like the oil-free. It's nothing for like. It's not the
Okay.
one with like the acne.
Okay.
But yeah, just oil-free.
So let's let the VISIA computer analyze your skin. So what
Okay.
we're going to do is we're going to look over here,
Okay.
and it shows that you've got a fair number of what we call spots on the face. And so the computer analyzes different types of spots, and it puts you in about the 50th percentile, which means that 50% of women have less spots than you do. But one of the things with the dryness has to do with inflammation, and so you can see that this red represents increased blood vessels and what's called erythema. And here you're not doing that well. So you can see that you've got a lot of inflammation or inflammatory lesions, especially in the chin, the perioral area. What I want to do now is look at sun damage. So you can look at sun damage two different ways. We can look at sun damage just by looking visually at brown spots. And so you've got a fair number of brown spots on your face, which is not just freckles, but it's a lot of sun damage. And this is probably one of the worst indicators here, is that you have a lot of bacteria in your oil glands, probably from not cleaning your face effectively. So the summary is what this is telling us. It's telling us that maybe we can do a little bit better cleaning your face. Maybe we can do a little bit better proactively trying to decrease a lot of the sun damage. And there are a few different procedures that we can do that'll also help. First thing that we can do is let's go through cleansing. So instead of just cleansing with a regular Dove soap, which is a very nice soap, have you ever seen this little brush called a Clarisonic skin brush?
I have. I've actually been looking into getting one.
Oh, cool. It's actually... Okay, I have no money in this company, but it's made by the same company that does the Sonicare toothbrush.
Yeah.
And what it does, it uses an ultrasonic energy, so it's not an abrasive brush. And by putting a cleanser on here and cleaning your face, it actually will lift a lot of the junk out of your pores, especially good around the nose area. And so this is something I recommend to use twice a day.
Okay.
The reason I want you to use it in the morning and the night is because during the day, you have moisturizer, sunscreen, makeup on, but also there's a lot of environmental pollutants, something called hydrocarbons, things that come from cars and burning gas and stuff. And that all gets into your pores, it can affect it as well. So this is the first most important thing. You can continue to use the same cleanser you're already using.
Oh, okay.
But
and you just put it on the brush?
Yes, it's a liquid cleanser. You could put on the brush and then use it. So that's twice a day, easy.
Okay.
The next thing is moisture. Absolutely, your skin's a little dry. And there are different kinds of moisturizers that you can use. The ones I think will work best for your face are ones that are not too oily or greasy. And so there's lots of different companies, but for you, SkinCeuticals has something called an HA intensifier, and I think that would be sort of perfect, give you a lot of moisture to your skin. And then finally, it's sun protection. And you know, with your pale skin, sun protection is very important. There's many different kinds of sunscreen. There's a company actually right here in San Diego called Color Science, and they make a very nice, very pure zinc titanium oxide sunscreen, and that should go on your face.
Do you do that on top of the moisturizer?
Yeah, so the moisturizer will actually go right in, and then you do the Color Science sunscreen right over.
Okay.
Now, nighttime for young women, because you said you're only 31, I like to take a proactive approach because you don't have wrinkles, so we don't have to treat wrinkles, but antioxidants would be really good to use.
Okay.
Because that'll help to correct some of the sun damage that you have. And there are a number of different companies that make a variety of antioxidants, and we can basically choose the one that acts with your skin the best. And there's companies called SkinMedica and SkinCeuticals, and so we'll choose one a little bit later for you.
Okay.
As far as procedures, I think the one procedure of all the 45 different laser and energy devices I have in this office, it's actually the least expensive laser that I would like to do, and it's called an intense pulse light. And it's just that, it's an intense pulse of light. The treatment takes literally 5 minutes to do your entire face. Hurts a little bit, but not a lot. We don't have to use any anesthesia. And what it'll do is sort of tone down that redness, that inflammation that we saw. It'll actually help a lot with your acne, and it actually prevents the development of skin cancer and helps to smooth out your skin, tighten your pores.
Perfect.
I would go into that thinking, just like a teeth cleaning, you'll probably need one of those treatments every 6 months.
Okay.
And in studies that we and others have done, when we look at a patient and then follow that patient photographically for 10 years, and these are patients that have had 1 to 2 intense pulse lights a year, they actually look 11 years younger 10 years later.
Wow.
So it's really something I think almost everyone should do.
Okay, perfect. And you think it'll help?
Yeah, it'll just make you prettier and keep you
good.
looking like that.
Okay, thank you.
Good.